The Divisional Director of Ezintsha at the University of the Witwatersrand, Professor Francois is now back on the line to chat to us about anything related to COVID-19. Now, Professor, you're just taking us through, some of the behavioral issues that some South Africans have with regards to coronavirus and taking all the necessary precautions, and some behaving as if the pandemic is still over.
Yes, I think it's very worrying. I think some of us have bought into the whole thing, but there's a whole lot of people who are really battling to keep this going. And I mean, I get that. I think it's been 8 or 9 months of real difficulty for people.
Yeah. And back in July, I remember I had a conversation with you, and you were highly critical of the COVID-19 testing protocols. And you said that it's a waste of time, a waste of money, and a waste of hospital resources. Just analysing the situation and just opposing it between then and now, do you still hold the same view?
So I do think that testing was very, very flawed before. It's been scaled down dramatically. There's still no coherent strategy around testing. And I think I'd be very nervous of interpreting the testing results that are coming through from the public and the private system. I think much more clear is the death data and the hospitalization data, and that we can trust. The testing processes have been very, very chaotic and continue to be chaotic.
I mean, when you say the testing processes were flawed and chaotic, how so? Where did the authorities go wrong, or how did they do it wrong?
So the initial testing processes did not prioritize hospitals, which were the places that really required prioritization. They just were, testing whoever came forward for a test, which is not a great way to collect data. It's also not a great way to identify people for isolation and quarantining. At the moment, the testing programs into communities appear to have been almost halted. So essentially, all you're getting for testing are the people who are either symptomatic who are worried, which is not a great way to work out who is at risk and who's getting sick. Mm-hmm. As I said, what we're looking at the moment is people who get to hospital are the really hardcore cases. The people who die, that's very clear that is actually something that is a disease that's marked itself as serious, as severe.
Now, there have been questions about the role played by the Cuban doctors who are here in South Africa and the WHO experts who were brought into the country to help contain the spread of COVID-19. So as someone who has been close to the action and also served in the Ministerial Advisory Board, what's your sense of their role and contribution?
I haven't had any contact with the Cuban doctors, so I can't really comment. The ones that came through to South Africa 10, 15 years ago, many of them were very qualified and very good at what they did. It's difficult to understand why we needed doctors when we had a whole lot of people who were unemployed at the moment. For the WHO experts, the rest of us have managed to do all our consultations by Zoom. I don't understand why we needed to import a whole lot of epidemiologists to a country which actually had a huge amount of experience in pandemics long before these WHO experts pitched up. So I do think that the critical questions need to be asked about these WHO experts. I have a lot of respect for WHO, and I think that WHO is an important part of the response to the COVID epidemic. I just can't understand why we need to import these people.
Okay, and you also work closely with people with HIV, and this was seen as a group most vulnerable, to COVID-19. But then the fears do not appear to have translated into reality. Why is that?
We're really lucky in that regard. There's really good data coming out of the Public Health Department at UCT. They did this massive study in the Western Cape that seemed to demonstrate that people with HIV are actually not that severely vulnerable to HIV, to the consequences of COVID. People with TB neither. So that was one of the few good news stories we have in South Africa, is that we know people with HIV. It's a slight increase in vulnerability, but it's very small. So as I said, we're not sure why. It was a huge fear while we were waiting for the epidemic to hit us. But we have pretty good data to suggest that people with HIV are pretty much the same as all the rest of us.
And there's much talk about so-called second waves in Europe and the United States. Are we heading towards the same direction?
We just don't know. And I'm sorry to say this to your public, because it's just really frustrating that we don't know. What we're seeing in different parts of the world are different kinds of epidemics. Some have a first wave and a second wave. Some have a first wave, and they lock down so severely that they just keep getting first waves and more first waves. So it's very important that people need to understand that we are getting different information points. It does seem as if we had a massive first wave, which in many ways might have protected us from subsequent waves. But it's important for people to just be very wary about coming to final conclusions in terms of what these different waves are going to look like. It really is very frustrating for all of us at the moment.
But then one wonders what could have possibly, given rise to the fears of a second wave in South Africa, because the weather conditions currently, and we're currently in the spring season, are not so favorable for the coronavirus to thrive, and as well as the figures, we've seen them dropping quite tremendously over the past few weeks.
So yes, but what we have seen in Europe is almost a seasonal thing, which we saw with pandemic flu, is people 6 months later get a very massive second wave. So we're not certain if we're going to get that second wave. So our worst epidemic was during June to July, so which would mean that our next wave would come in December and January, which if we follow Europe, that might be what happens. But that's a big if. We might have a massive first wave and a continual burn. We might have a massive first wave and smaller second and third and fourth waves. We might have a massive first wave and then an even bigger second wave, which is what happened with the pandemic flu. So none of this is reassuring. I think if I had to guess, and it really is a guess, is we had this massive first wave and we may have subsequent smaller waves, but where it focuses on hotspots that weren't affected. The bad news of that is that it doesn't matter if you're old, if you're diabetic, if you have hypertension, if you're on chemotherapy, it still means that you are still very vulnerable.
The WHO, Professor, has announced that a vaccine for coronavirus, we could have it possibly by the end of the year. Since we are just a couple of months away from the year end, does it not sort of promote complacency among people, knowing that a vaccine is nigh?
So I don't think the vaccine is nigh. I think it's a huge mistake to believe that the vaccine is around the corner. It might be, and we've certainly got amazing South African scientists looking at it at the moment. But anyone who's looking at this as the magic bullet that taken for granted is deluded. We need to be assuming that we're not going to have a vaccine for at least another year. And even if we did have a vaccine, South Africans need to understand we're going to be at the back of the queue behind a lot of rich countries which are going to be able to buy this vaccine ahead of us.
Right. And you were not always in favor of some of the restrictions that were imposed during the height of the coronavirus in South Africa. What would you suggest then should be done to contain the virus spread if cases surge?
I think that we just need to continue with the physical distancing. We need to continue with the masks. We need to be continually thinking about how do we make people less vulnerable than they are at the moment. I think that's pretty much it. There's nothing special here. We just need to be making sure that we protect people as much as we can. We need to assume we were not going to see a vaccine. And for that reason, we need to be very careful about just assuming that everything is going to be okay in the future. We need to protect all the vulnerable people in our society by just implementing cheap and easy stuff as we're going forward.
Right. Professor, great chatting to you. Thank you so much for your analysis and your insights into this matter.
Thank you so much.